Both my parents had heart disease and died young from it, so I wanted to get on top of it. But then my world started to fall apart. My youngest daughter was diagnosed with autism, and the stress of trying to find her a new school and the diagnosis was pretty overwhelming. But what really brought me to my knees was when I experienced a cerebral spinal fluid leak in my brain. It required surgery, an extensive hospital stay, and after I recovered, that's when I realized that my weight probably played a factor. And then I got serious and started to research bariatric surgery. I chose Rush after meeting with Dr. Amatosho, one of the bariatric surgeons, and we discussed weight loss surgery options. I chose gastric bypass. Rush has so much experience with this particular procedure, and their reputation is outstanding.
The two most common bariatric procedures are sleeve gastrectomy and gastric bypass. Both of these operations are performed laparoscopically. This allows for faster recovery and less pain. Considering Maria's family history and health issues, we decided on gastric bypass. With this procedure, patients can lose up to 80% of their excess weight in the first year after surgery. But weight loss isn't the only thing we're after, or even the main thing we're after with bariatric surgery. It's important to remember when we're discussing bariatric surgery that obesity itself is a medical condition, and there are other medical conditions that are associated with obesity. That's what we're really after with bariatric surgery. Our team of specialists help patients like Maria. In her case, sleep apnea was a factor, and she had already undergone a procedure for her brain. We wanted to make sure that she was emotionally and physically ready for gastric bypass. I'm happy to say for Maria, the results have been outstanding. On the day of surgery, she weighed over 250 pounds. Even better, her sleep apnea is resolved. The headaches that she suffered before surgery are significantly reduced, and she's much more active and healthy.
We come up with a plan for how the patient is going to talk to significant others in their life about their surgery. Family, friends, co-workers. Many people naturally have questions. And so we want the patient to feel safe in being able to talk about the changes that they're going through with those people. Some patients just feel guilty about doing something for themselves, and they struggle with the idea that bariatric surgery is elective. It's my job to help people process those feelings so that they don't interfere with the patient's progress and their journey to a new, healthier self.
My experience has been fantastic. Not only do I weigh 118 pounds and I'm a size 4, but most importantly, I'm healthy. I can't say enough about the support I got from the Rush team. If I have a question, I just reach out via my chart or I call the office and somebody gets right back to me. I'm not on the sidelines anymore. I'm no longer embarrassed about the surgery. I have the full support of my friends and family and coworkers. Just this past Christmas, my father-in-law said to me, "You look great, good for you." I never could have made it without the support of the entire Rush team.